Hi, this is Rick Yates, Technical Services Manager for GGS Pro and Griffin. During the winter and spring season of 2022, we've had a reoccurrence of bacterial blight of geranium. Part of what makes Xanthomonas of geranium such a difficult disease to deal with is the fact that very soon after infection it becomes a systemic blight in the plant. When we refer to primary disease transmission, typically what we're talking about there are infected stock plants where cuttings are taken off of it and then either rooted or shipped unrooted to customers, and the disease shows up later on. This can also happen if a grower who is a propagator is taking cuttings off an infected plant and doesn't properly sanitize their tools between stock plants. It's very easy by sap transmission to infect the next set of cuttings. Secondary infections are a little bit different. This is a case where we have infected plants in the greenhouse, and perhaps without the knowledge of the grower yet, when they are irrigating overhead, either by hand or using booms or sprinklers, the splashing water can move bacterial ooze off of the infected plants onto nearby plants that were previously healthy. Anything that involves handling the plants, cleaning, pruning, spacing, moving them around the greenhouse, all these things can cause the growers to have infected sap on their hands and even on their clothing, and then make infection into otherwise healthy plants. And you don't have to have a wound in order for this bacterial ooze to make infection. Should point out there's no cure for infected plants. Once we know that a plant has Xanthomonas, it needs to be destroyed. And we'll talk a little bit more about cleanup and sanitation at the end. Understanding the symptoms associated with Xanthomonas is going to be really important. So we want to talk about the way that the different method of transmission influences symptom expression. The primary infections that we just discussed, when they're coming off the infected stock plants, generally the first symptoms that you'll see are some yellowing and wilting. It may happen at once or one right after the other. But at this point, there's no leaf spots whatsoever. The very best diagnostic tool that I use for these types of infections is that the leaf petiole is erect as it should be, but the leaf blade droops down like a flag with no wind. Secondary infections go the exact opposite direction. The very first thing you see are leaf spots, usually associated with yellowing, but those leaf spots are generally first. Often the yellowing will take the shape of a V-shaped wedge that opens up with the widest part of it being at the margin of the leaf. But the yellowing doesn't have to be associated with the spots, and really doesn't even have to happen for wilting to occur, which is the last stage of a secondary infection. In both cases, the roots are typically unaffected, and that's a good diagnostic tool if you're concerned that perhaps you have Pythium. If the roots look great, you need to dig deeper. This picture shows a very good representation of what we often see when geranium suffering from a primary infection of Xanthomonas. And you can see there's a good bit of yellowing going on. The far left shows one of the distinctive yellow wedges. Doesn't always look quite that distinct. And then on the far right, you see the symptom that I was describing previously, where the petiole of the leaf is erect, but the leaf blade is drooping like a flag with no wind and turned yellow. This picture shows a good representation of what is typical with a secondary infection. In this case, a healthy plant was in close enough proximity to an infected plant that either through irrigation, bacterial ooze was splashed from one plant to this one, or perhaps due to handling and cleaning and so forth, infected sap from one of those infected plants came in contact with the foliage of this geranium. You might recall that we said we don't even have to have a wound in order for the bacterial ooze to make infection. In this case, you can see the very first symptoms to show up were the leaf spots, the exact opposite of a primary infection. To the right-hand side of the slide, you're starting to see a little bit of yellowing occurring, and even the V-shaped wedge seems to be taking shape in a couple of places, but there's still no wilting. If we didn't remove this plant soon enough from the greenhouse, it would eventually start to see the characteristic wilting. We typically think of Xanthomonas infections on geraniums either as rooted or unrooted cuttings, so it shows up very early in the crop cycle. However, geraniums can be affected at any stage of development, so we need to be really careful about that. In addition to zonal geraniums, which are probably most known for Xanthomonas, ivy geraniums are also highly susceptible, as well as your interspecific hybrids such as the calliope type geranium. Seed geraniums are also highly susceptible to Xanthomonas. Regal geraniums, most are believed to be resistant, although leaf spots can occasionally be observed, but bear in mind that they can be a carrier for the bacteria moving on to zonal geraniums through handling. Perennial geraniums are also believed to be symptomless carriers in most cases. capable of spreading it. If you've been warned that Xanthomonas could potentially be in your crop, or you've seen the first signs of it, you're going to need to take a very rigorous process to try to contain it as much as you possibly can. The first thing to do is make sure you scout the crop often. We know that the warmer the temperatures in the greenhouse, the more rapidly the bacteria will proliferate and the faster the symptoms will show up. If you're suspicious that Xanthomonas may in your crop, do everything you can to avoid direct contact. So delay spacing and handling and moving the crop around until it becomes clear whether or not Xanthomonas is indeed in the crop. If you're suspicious at all, we really want to encourage you to send a sample to a plant diagnostic lab. You can also order test kits from Agdia. The test kits are very user-friendly, by the way. If you get a positive test, then you want to not only dump that particular plant, but what's called the splash zone, which is around a 3-foot circle around each infected plant. You can see how it wouldn't take very many infected plants to really start decimating the crop. And then you want to continue your daily scouting because, again, plants may show symptoms at a different pace, and also depending on when and how they got infected, it could take a while for all of the Xanthomonas in your crop to show up. The test strips from Agdia are said to be about 92% accurate in their determination. They're very quick and easy to use. It takes less than 30 minutes from start to finish to get your results. Sanitation is incredibly important because we're trying to do everything we can to keep from spreading this disease to other geraniums in the greenhouse. Once infected plants are identified, and we talked about how we're going to dump that 3-foot circle around them, something I could add to that discussion is that we need to be really careful that we're not spreading the disease in the process of dumping them. Generally, you want to have as few employees as are necessary to get the job done, and you'd like to have them do it with gloved hands and plastic bags at the end of the day. And that way they're headed home after that task. It's the last thing they do in the greenhouse for the day, and by the time they come back to the greenhouse, they have showered and have clean clothes on to keep from spreading bacterial ooze to more plants. First thing we need to do is clean the infection site. And this is really important because the best sanitizers will fail if we don't adequately clean the surfaces to be cleaned, your bench tops, things like that. There's a couple good products out there. If there's plants present in the greenhouse, in other words, we're not dumping the whole house, just a portion of it, then Hortichlor or the Green Clean Alkaline Cleaner are good choices. If there's no plants present in the greenhouse, you can use Strip It Pro or a Green Clean Acid Cleaner. Both of these will do a really good job. Once the surface has been thoroughly cleaned, it's time to apply a sanitation product. With all sanitizers, it's really ideal to keep the surface wet with that sanitizer for as long as possible. 10 minutes is what I'd like to shoot for, but even 5 minutes should do a very good job of making sure you get complete control of this bacterial disease. There's some good quaternary ammonia compounds you can use. Green Shield 2 and Clean Grow are labeled for this purpose. And then activated peroxygens such as Sanitate and Xerotol are also very effective. Growers ask about using bleach, and while at the proper rate it can be very effective, it is really not safe to use either for people and certainly not if there's any plants in the greenhouse. So we suggest you use one of the other sanitizers. TGS Pro is available to talk to you about Xanthomonas, whether it's detection or cleaning up after it or any other grower topics that you might have. So please feel free to use the contact information you see here to contact us.